to the DMF Podcast, where you will get to hear conversations with community leaders, charity spotlights, and information on upcoming DMF events. I'm your host, Whitney Isaacson, and today I got to sit down with Mike and Mary Beth Traynor. Mike is a Sanford MD, and Mary Beth is the Vice President at Shanley High School. The Traynors are also the founders of the Matto Foundation, where they get to work to delay, decrease, and defeat substance abuse and addiction among adolescents. Today, the Traynors shared about their incredibly difficult family story from the evolution of the Matto Foundation and losing their son Matthew in 2016 to addiction. They shared personal experiences from turning this hardship into inspiration and the lessons that they've learned along the way to make this foundation bigger than just their story. I think you're really going to enjoy my conversation with the Traynors today, so let's get into it. All right, well, welcome to the podcast, Mary Beth and Mike Traynor. It is so exciting to have you guys sit down with me here today, and just thank you for everything that you guys do, seriously.
Thank you for having us.
Oh, all right. Well, can you guys share a little bit about your titles, your roles, what you do professionally, and what you're most passionate about in that work?
So my real job is I'm the chief of surgery at Sanford Health, which is the largest health system in North Dakota. And as part of my job there, I also teach at the University of North Dakota Medical School. We train surgical residents, medical students, PA students, nurse practitioners. So that's kind of what consumes most of my employment.
Right. What are you most passionate about with all of that?
Well, it's very rewarding to take care of people that are ill and sick, and then you intervene, you operate on them, do a procedure, and they get better. But that's kind of goes without saying. I think that's very rewarding as a career. But one of the things that I find the most rewarding, or I think will be a legacy for me, is all the medical students and residents that I've trained. I've been training surgical residents and medical students here at North Dakota since 1991 when I finished my residency. So initially the surgery program here graduated 2 surgeons a year. Now we graduate 5. So that's a lot of surgery residents that I've helped train. And a lot of them are in our community here or throughout the state of North Dakota, Minnesota, Montana, and throughout the country. So I think of all the things that personally I'm proud of. That's one of the things that I really think is a great thing that you can do. It's kind of like Yoda, pass on what you have learned, right?
Very rewarding. Yes. Mary Beth, how about you? Title, profession, what you're most passionate about?
Well, I have worked for St. John Paul II Catholic Schools now for 24 years. I've held a variety of positions. Most recently, I finished my 7th year as the vice president. And that's a different model of education, private versus public school. And I think as vice president, I work very closely with the day-to-day operations of our system. We have 3 elementaries, a middle, and a high school. And I work with the principals and making sure the day-to-day. I feel that my passion is youth. I have a very dedication, if you will, to the youth. I think youth advocacy is one of my strengths and passion in our system. I have always been advocating for students in their learning and in their mental health. So I have definitely been poised to be the vice president and work with the principals on student life in our system. So I would say that's my biggest passion is youth.
Wow. Well, I love to hear it all because you guys are just very passionate people, and getting to hear what you guys do outside of the Matto Foundation is super awesome because with your full-time jobs, you guys are also the founders of the Matto Foundation, where you're working to delay, decrease, and defeat substance abuse and addiction among adolescents. So kind of jumping to the passion again, what are you guys most passionate about in that work?
I think It really boils down to the youth. And when we first started the Matto Foundation, we were looking at substance use. But as you look at addiction, it really goes deeper. And this is something we all can get behind, is our youth, because that is the future. It's the future of this region. It's the future of the United States. It's really our future. And helping our youth be the best possible people they can be is the passion that we have with the Matto Foundation. And rallying adults around our youth. It should be easy, right? But this is the passion we have. The mission that we have is the youth in our communities.
So I'm kind of curious for you, Mary Beth, with that is when you think about our kids and the youth and being like the happiest, healthiest versions of themselves, what are some things in society that we don't really talk about and we need to pay attention more about with their whole development, their mental, emotional health?
I think that during, being in the schools, working in schools, and the pandemic itself brought to light a loneliness that our kids have. However, it was around a long time before the pandemic, but it really brought that social isolation out and to the forefront, and people started talking about it. We are talking about it. A lot of that has had to do with the digital age. It has made students less connected with their peers as well as adults. And now we're having conversations around that. People are looking at it. They're looking at the addiction that they're actually experiencing. And, addiction is not just to illegal substances or legal substances. It also has to do with this technology. And they used to say, just ask your child, they'll help you with their technology. It was introduced well before the adults had control or were able to look at the long-term effects of something like this, the technology. And I think our students, there's a lot of research out there, even at college level, of students don't feel a belonging anymore. Then they now are looking for a sense of purpose in life. Mm-hmm. And so if we can get out ahead of that too and help them with that sense of purpose. I think the other thing is devices. And I've had this conversation, and I am anxious to make it more at the state level for some of the committees I serve on. But we're always worried about how what's happening digitally in our classrooms and everything, when we don't want to replace a teacher. We don't want to replace those connections that students make with one another. And this is, for an example, we're doing an experiment in our high school, Shanley High School, where you cannot even bring a cell phone into the building right now. And our principal, I know you have visited with him, Whitney, looking at what the lunchroom used to look like. The people would be conversing with each other by texting each other across the table. Well, I can guarantee you our lunchroom is very noisy now because they are actually having to speak to one another. And they're having to, again, do something that they haven't been doing because they just text one another, and that's how they stay connected, if you will. But now we're having to make connections. We're asking the kids to make connections where you're looking at each other and speaking to one another. And you speak differently when you're looking someone in the eye. You're kinder. And we're anxious to see some surveys as post when we finish this year, as post not having your cell phones, the device is just readily available to you.
I can't wait to see those surveys as well. I think it's going to be so interesting to learn. And you kind of touched on the whole digital piece that plays into the loneliness, the purpose and meaning. Mike, did you have anything to share with that, especially maybe what you see in the hospital?
Well, I want to talk a little bit about some of the things that, is not being put out there in the general information or general public. And one of it is, all this legalization of marijuana around the country. The marijuana now is much stronger than it was in the 60s, 70s, 80s. And the problem that it can cause especially with young kids, which is really our focus with the Matto Foundation, is early use causes them to develop addictions earlier, and then long-term use of marijuana causes schizophrenia. And, Matthew basically developed a form of schizophrenia related to long-term marijuana use. He started when he was about 13 or 14. And, I spent my whole career making people better, taking their acute appendicitis out, their appendix out, taking cancers out, but I couldn't get him better because of it. Now, if you develop schizophrenia, it never goes away. You have it for life. And no one's talking about that, and no one's talking about they're legalizing, marijuana all over the country. It's really being driven by revenue, tax dollars, and people wanting to put up pot shops and things like that. But that's not what you're going to hear. And, we just went through the opioid epidemic. We're still going through it when they were prescribing too many painkillers. And I bet in 10 years, we're going to find out that with this legalization from state after state after state, that it's going to make the opioid epidemic look like a picnic, because marijuana is the gateway drug to all the other stronger ones. Because when you develop an addiction, when you take a hit of dope or marijuana, your dopamine level goes to a much higher level, and you get to a point where you're requiring more and more to get to the same levels. So what you'll do is, if you can't get it with increasing levels of marijuana or alcohol or whatever it is, you'll go to a harder drug. And then, you've got more and more problems going forward. So
right.
No one wants to talk about that now because it's not really in vogue, but that's really what's going on around our country.
Totally something that society doesn't talk about with youth development and mental health. So you kind of touched a little bit about the dopamine with these compulsive behaviors. And so I know you guys sponsored the Dakota Medical Foundation Summit last August, where we brought in Dr. Anna Lemke, who talked about digital addiction and dopamine and how all of it plays together as, reflecting back on how drugs are an addiction, how they impact us, but also how digital addiction is, shown to have similar effects. So with that dopamine, there was a quote from Anna Lemke from that event that said, "We are living in a world where we have all become more vulnerable to compulsive consumption, despite the harm to self or others. We have highly rewarded substances and behaviors at the touch of our fingertips." And you guys have walked that in personal stories. You see that in your work. So when you look at these consequences of compulsiveness and around behaviors and substances, what have you guys seen from your stories or advice on how to healthily manage these things?
Well, as Mary Beth alluded to earlier, there's more than addictions to just narcotics, drugs, alcohol. You can be addicted to gambling, sex, your cell phone, your computer. Dr. Lemke's book is an excellent book. It's she even talks about in her book that she personally was addicted to the Twilight series, the vampire series. And she found herself staying up late at night, not ignoring her family, her own family. And she's in the business of treating this. And she finally visited with a graduate student, and he kind of pointed that out to her, and the light sort of went on. And so she has to make a concerted effort to stay away from those particular activities. Now, that doesn't cause the type of grip on you that illicit drugs or marijuana and other narcotics do. But still, we can be addicted to all kinds of things, and we don't even know it. Sometimes you can control them, and other times you can't. And in terms of drugs and alcohol, if the addiction spirals out of control, they're all lethal. I mean, eventually, if you can't control it, every person will die of that addiction.
Right. Those behaviors, it's no matter how big or small, whatever it is, it creates that narrow pathway where it's so easy to go back to it and creates that addiction. Mary Beth, did you have anything with that?
Well, I think when we were talking about digital addiction, I can liken it to behaviors that we saw with Matthew, maybe not to the full degree, but when you even take, I've seen it with a grandchild of mine. You don't allow them to be playing a game on an iPad or a phone, and they become irritable. And it's that irritability, we saw that a lot with our son Matthew and his addiction, but it's that, irritability, that's inability to sleep or get themselves to sleep. These are all things, if you're seeing that with your young child or your any child of yours, these are signs of addiction, and it's a sign of, those dopamine levels. And the best thing you can do is quit for 30 days on the addiction, because that's when your dopamine levels will start to come back down and level out. And one of the things, I'm just thinking about this, but one of the things I remember Mike and I visiting, we're both have medical backgrounds, but visiting with Matthew's treatment people, the way they gear treatment is for 30 you're in for about 30 days and insurance pays for it. Well, for someone, maybe adults can handle that, then they're ready to start dealing. Their dopamine levels are down and they can start dealing with that. But when you're dealing with an adolescent, they're just now after 30 days and after they haven't been had the substance, or I even think of the digital, the phone, they're just starting then to be able to absorb what you're trying to do in treatment. They're not ready to be out in 30 days. And I know Mike and I have talked quite a bit about dopamine and the role that it plays. And I know it's very technical, but people should really look because you can begin to understand what happens to you, whether it be on a full scale of substance uses, drugs, alcohol, or even with digital. You can begin to understand what is happening to you. And I think if you learn more and make an effort to read about dopamine and what it does, that people are able to maybe address that before it becomes too much of an issue.
Right.
So the dopamine thing is a neurochemical, and it's probably kind of hard to understand if you're a lay person. You kind of have to have but let me put it in perspective. If you take rats and send them down one area where they can get something to eat, and then you send them down another path where they can take cocaine, they will preferentially go down and take the cocaine till they starve themselves to death. And those rats are addicted, and that's what happens to us as humans, unfortunately. We're not much better than a rat when it gets right down to it, because we're all mammals. But when people are truly addicted, they will give up everything else that they like. And Matthew did that. He gave up hunting, fishing, every other thing that he used to love, sports, and all he wanted to do was to continue to take those substances. And that's what will happen to your child too, and potentially if you don't keep an eye on things. And, people always say, well, that's not going to happen to my family. We don't do that. Addiction doesn't work that way. It crosses every race, every sex, every economic thing that you can think of. It doesn't discern. And, your child is just as susceptible to it as any other child. The only thing that we do know is if you have a relative, like a parent, an uncle, or a grandparent that are addicted, you have a much higher chance of becoming addicted yourself if you start, especially as an adolescent.
Right. So kind of thinking about your guys' story and everything with dopamine, addiction, and kind of just the youth development, what advice would you guys have for families or people that have walked or are walking through similar situations or stories? And what are those warning signs? How do you practically keep an eye on this and pay attention to what your kids are paying attention to before they're developing these compulsive behaviors?
I think something, Mike and I have gone over this many times, and we've been asked, what's one thing you could have done? Or one thing that would have helped Matthew? And okay, number one, it's never start. So, if you have liquor in your house, lock it up. I'm not here on prohibition, but what I'm saying is alcohol and your children, they don't mix. So lock it up. I'm not asking you to never take a drink yourself, but what I would say is keep it under lock and key. We had this liquor cabinet at the lake. We don't even drink hard liquor. And lo and behold, that's where Matthew got his start. So lock it up. And, we had him in all kinds of sports, all those action items that you think would be protective. He was busy in sports and busy in this and busy in that, and we were home a lot of the time. But sometimes it's who their friends are. Sometimes it's them. But I would say my biggest advice to everyone is child never starting. And it's not norm behavior that your child drinks in high school. And don't ever norm that. It is the earlier the evidence, we have research, and it's very vetted research that the earlier a child starts with substances, the more apt they are to become addicted. So that would be my advice.
One of the things that I can remember in retrospect, you have, when you lose a child, you never get over it, but you have all these regrets. One of the things that I've thought about, besides what Mary Beth just said, is, Matthew started talking about things like, street drugs, and he started talking, his choice in music changed. And, we kind of got taken out by surprise, and we're not parents that are running around, socializing. We did everything with our kids. I mean, even to this day, we can't even go on a vacation. Now we have our grandkids they're always going with. But, as I look back, I wish it would have hit me a little harder that something was going on with him. And maybe if I could have interceded, maybe I could have helped. But I think the problem with Matthew is, like many kids, he had the propensity to become addicted because he's got, a grandfather that had a problem. He's got, other close relatives that have trouble. And the first time he smoked weed, probably the die was cast for him, unfortunately. And that could be your son or your daughter. It only takes one, and they get that initial high, and then they're like, they've never felt like that before. Now, if they wait till girls, they mature a lot faster, 21, 22, their frontal lobe is developed. Boys, it takes them till about 24 or 25. And if they start before then, they don't have the checks and balances in their brain to be able to handle that stuff yet. If they can delay it, you don't need to do it in high school. In fact, you don't need to do it at all, and you'll live a perfectly good life. But if you are going to do it, wait till you're a little older. Wait till you're out of high school, your brain is developed, and even if you have that in propensity in your family, you'll have a lot less chance that you become forever addicted to it.
Right. Well, thank you guys for sharing so much about your stories as well. And on the note of advice, I want to ask, from turning such a tragic hurt into something positive and making it bigger than yourselves and, the memory and legacy of Matthew, what's your advice, or what are some lessons you've learned over the years of starting this foundation, the evolution of the Matto Foundation? What is your advice for anyone out there?
Well, I think be vigilant with your kids. You're the best chance that they have to live a healthy, successful life. And, if you see your child going down the wrong path, they're being addicted to whatever, try to intercede and try to get them the help that you can. Now, when we went through this whole odyssey with Matthew, we found there was a lot of stuff out there for adults, addiction programs, AA, those kinds of things that for many people do work, and they've miraculously saved millions of lives, really. But for kids, there isn't a lot out there, and they're not the same animal as an adult. Their brains aren't developed, and we're not sure that a lot of the treatment that he did, although it was helpful in the short term, in the long term really didn't help him, because I think the die had already been cast with him. He started too early, and he was not able to get out of the spiral. There's people that can help you. There's physicians, your pediatrician, your minister, your priest, your good friend. You have to, if you have a child struggling with addiction, you have to be careful, because there's people out there that will judge you adversely, and they'll make you actually feel worse about yourself and worse about your child. And you don't have to feel bad. You're not alone. There are literally millions of people in this country and around the world that are struggling with that as a parent or a loved one. And if someone in your family comes to you and they want help with addiction, don't shun them. Welcome them and say, what do you need? How can I help? I'll do anything I can to help you. Because if we can't look after each other in our own immediate family, how are we going to look after each other in our communities and the rest of the world? You just need to reach out. There's people there that can help you.
It's very good. Mary Beth, anything on lessons learned, advice, anything with the evolution of the Matto Foundation?
Yeah, when you say that, I there are a few things. Matthew's been dead for 8 years now, and as I look and I think back, there were times I thought he has no remorse, and it was hard sometimes to reconcile that and understand that. I'm such a humanitarian anyway, but for me, it was hard to understand how he could do some of these things, and I was feeling like he was doing them to us, to his parents and his family. But I have been able to reflect and learn more and understand the why. Kind of understand what happened. And he couldn't
stop. I've said this many times when people ask me about it. It was like a possession. Not that he was possessed by the devil, but he was absolutely possessed by the drugs. And I don't know how to say it any other way than that. And, I had someone said to Mary Beth one time, aren't you mad at him? And although going through it, sometimes you got very frustrated and mad, but we're not mad, and we weren't mad with him at any point during the thing. We loved him. We wanted him to get better. What we're mad about is he couldn't get better. There wasn't something that we could do for him to make him better. So, it didn't work out so well for us. But maybe by setting up this foundation and doing this work, it'll help some other family or some other community to get through something like this.
Mm-hmm. Yes. Well, such an incredibly tragic story, but you guys are such beacons of light in our community, and, you know, just sharing your story is so powerful, and it's truly an inspiration in the hardest but most genuine way. And so for anyone that's listening, how can they follow along, or how can they support the Matto Foundation?
Well, thanks for asking. I would for sure guide you to our site, mattofoundation.org. We do have a lot of information. We have hired Whitney, who's sitting here with us, who has done a phenomenal job in helping us increase awareness and work on activities and things with the youth to just get the awareness out there. And so visit our website. We have Giving Hearts Day coming up, so that's a wonderful thing. If anybody would like to help, we always need people to help us do calls, write thank you notes. We ask, just to join the community on Giving Hearts Day. There's many, many charities out there that are very worthwhile giving to. And of course, the Matto Foundation, we continue to support activities around addiction and of substances and any other addiction of youth in our community. So that is definitely a way that you can support it, and just increase in awareness. Talk about it. Talk about it with your children. Talk about it with your niece, your nephew, your grandchildren. Don't hide. Hide the subject. Talk about addiction and substance use, and don't norm it, because I think that's the hardest thing I feel we fight against is some people around think it's okay for high school kids to drink or smoke or vape or whatever, and it's not. And I think if we can say one thing that we're about is about stopping that and helping people understand why.
Right. Well, thank you guys so much. That's such powerful words today. And I just appreciate you guys sitting down on the podcast with me today and having this very amazing and open conversation. Thank you guys so much.
Thank you.
Thank you, Whitney, for all the work that you're doing to help us with this project. It's been phenomenal having you on board. We love it.
It's my honor. Well, thanks again.
Thanks.
What a great conversation today, getting to learn about the evolution of the Matto Foundation and how Mike and Mary Beth have turned this hardship into a foundation of inspiration for others. All right, folks, so that wraps us up for today. Thank you so much for listening. We hope you enjoyed this episode, and we will catch you next time on the DMF Podcast. This is Whitney, and I'm clocking out.